you're around any child that's actively convulsing or actively seizing, this is what you have to do. First, be calm. Try your best to be calm. I know it's a scary scenario, but just try your best to be calm. Now, once you're calm, next thing you have to do is remove every sharp object around that child. Anything that can cause injury to the child, remove it. Then, once you've removed it, turn the child to the left lateral position. What do I mean by that? Let the child lie on the left side. Then keep the child like that for some time and then allow the seizure to stop on its own. Please do not put spoons into the mouth of that child with the aim of I am trying to stop the seizure. Do not put your hand because once they bite, they will bite off your hand and you will come down to the hospital for suturing. So don't put your hand into the mouth of that child. Then another thing, don't use cow dung or don't use any of all these herbal or whatever to try to stop the seizure. Allow this, there is nothing you will do that will stop that seizure at that moment. That's what I want you to know. Yes, there is nothing you will do that will stop that seizure at that moment. So all you have to do first is let that seizure stop on its own. Once it has stopped, carry the child and come down to the hospital. In the hospital, we will now evaluate the child and know how to pick it up from there. So, but if possible, if you want, you can still carry the child like that and then come down to the hospital. But just know that most seizures stop on their own, except what we call status epilepticus, which is when the seizure lasts longer than 5 minutes. So in this case, it's usually more of pointing towards a cerebral issue. But most of the seizures children have is usually febrile seizures due to fever. So if you are sure that whenever you notice that your baby's body is hot, please quickly administer paracetamol and tepid sponge to bring down that fever. If you've not watched my video on how to handle fever, you can go down and watch it. So do this, then come down to the hospital so that your child will be properly evaluated. Share this video to family and friends. We are on a mission to create awareness. Have a nice day. Bye.